அத்திலக வாசனை போல் அனைத்துலகும் இன்பமுற எத்திசையும் புகழ் மணக்க இருந்த பெரும் தமிழனங்கே தமிழனங்கே உன் சீரிலமை திறம்பியந்து செயல் மறந்து வாழ்த்துதுமே வாழ்த்துதுமே வாழ்த்துதுமே.
Good evening to one and all.
Thank you.
Thank you, Vijaya Madam.
Thank
Good
you,
evening to one and all. At the outset, I express a deep sense of gratitude to the authorities for permitting us to conduct this webinar in association with Miyat Hospitals, Chennai. I am very happy to welcome Professor P.V. Selvam, Dean Faculty of Education, a versatile sports person who's always extending his help in all our activities conducted by the Department of Education. On behalf of the department and my own behalf, a warm welcome to you, sir. Today's guest speaker, Dr. S.P. Kurunjinathan, is a psychiatrist trained in UK and has been serving there for 2 decades. Presently, he is the head psychiatry at Miyat Hospital, Chennai. He is periodically conducting this type of online webinars on various aspects of psychology. In spite of your busy schedule, sir, you were gracious enough to accept our invitation and for being with us this evening to share your expertise. On behalf of the Department of Education and my own behalf, a hearty welcome to you, sir. I welcome Professor V. Ambedkar, Head Department of Education. He is known for his simplicity and dedication. Any task assigned to him, he sees that it is performed in a meticulous way. It is his encouragement that the program is seeing the light of the day. I welcome you, sir. Participants are a source of inspiration to conduct such programs. I welcome each and every participant who have reposed faith in us and joined this program. I am sure Dr. Kurunjinathan's speech will be highly beneficial. I welcome you all. I also welcome my colleagues, my fellow organizing secretaries, Dr. V. Susila and Mr. K. J. Prakash, who are helping me in this venture. I welcome one and all. Thank you for the opportunity. Now I request Professor P.V. Selvam, Dean Faculty of Education, to give the inaugural address.
Good evening, all of you. First of all, I thank the university authorities to permit us to conduct such webinar because there is a very essential due to that COVID situation. So mental well-being is needed for everyone else. That the Department of Education under the leadership of Dr. Ambedkar, Professor and Director. So the organizing committee members, they have the right choice to choose a topic. Audible?
Yes, sir.
Okay, especially every human beings, even if those are affected for COVID also, are not affected people also, everybody they are facing the mental problem because that all psychological problem that should be arises. So if you have the mental well-being, so anything happen, we can ready to face that any problem. So in this occasion, once again, and congrats the organizers to have a nice opportunity to enrich the knowledge to all the society. And also, I congrats the Dr. Kurunjinathan sir from Miyat. So to come over here after, apart from the busy schedule, he come over here, he accepted our invitation and come over here. Really, it's a great thing, sir. Because of you, everybody they are going to benefited. I thank you one and all for all you. Pravina madam, unmute your mic, madam.
Now I request Dr. V. Ambedkar, Professor and Head Department of Education, to give his presidential address.
Most respected Dean Faculty of Education, Annamalai University, Dr. P.V. Selvam sir.
Recording in progress.
Dr. S.P. Kurunjinathan, Head of Psychiatry, Miyat Hospital, Chennai. The organizing secretaries, Dr. K. Previna Madam, Dr. V. Susila, Jay Prakash, and my dear participants. It gives me immense pleasure to speak to you as presidential address in the one-day webinar on mental well-being after I assume as head of Department of Education. It is really needed to me. We know that every individual should have mental stability, mental well-being, because every individual wants to achieve certain things in my life, so that they have to face a lot of problems and they have to face it in a successful way, for which they need certain steps. Normally, we know that we are having two types of mind. One is emotional mind, another one is rational mind. Normally, the emotional mind works first, then only the rational mind works. So we should not give more importance to the emotional mind, but we have to give importance to the rational mind. If we give rational mind, then only we can go the correct path. So during this pandemic situation, if you want to be a well mentally, what we call a peaceful man means you have to follow certain steps. That is, you have to contact with the people. You are always should be connected with the people. Then only you can free from your fear. We know that the ultimate aim of education, according to Tande Periyar, is a man should be free from fear. That means when we are connected with the people, we are free. The next one is we have to be active. We should not passive. We must be always active. Then only our brain, our body will work. So we know that the sound mind in the sound body. So every teacher and every individual should be very active. Then during the pandemic situation, most of us are at home. During that period, we must make use of the time by the way of learning a lot of things. Every individual should possess skill and will. Then only they can lead a good life. So if you want to be a mentally well-being means you have to learn certain things. Not only that, you have to feel the feeling of, instead of I feeling, you have to feel we feeling. We, our, as such a way we have to feel. That means we have to think as the way Vallalar thinks. It means he has to think the things as his own. Such a way we have to think. Not only that, we must give certain things to others. It may be happiness, it may be kindness, it may be love, whatever it may be. We must give others. If you give others, then only we will be very happy. Then we have to be attentive, or we have to be very alert. That means we must be attention towards the things which are all happening in and around the world. Then only we are updating ourselves. Unless we are update ourselves, we have become outdated. So dear friends, I think that this webinar will help you how you can keep your mind in a well and balanced manner. I take this opportunity to thank our Dr. S.P. Kurunjinathan sir. Even though he has got a lot of schedule, he accepts and he is spending his valuable time to us to enrich how we can make our mind as a good one, for which I am really grateful to you, sir. On behalf of the Department of Education, I thank you, sir.
Okay, thank you very much.
I thank all the organizers for organizing such a wonderful webinar, and I wish them all the best. Thank you for the opportunity given to me. Thank you, one and all.
Thank you, sir. Now a brief introduction to Professor Dr. S.P. Kurunjinathan. Dr. S.P. Kurunjinathan is MIOT's renowned psychiatrist with over 22 years of experience in this field. His areas of expertise is psychiatry spans across child and adolescent, forensic, general, adult, and geriatric. Having trained in prestigious institutions in the UK for almost 2 decades, he has unmatched proficiency in treating anxiety, depression, dementia, delusion, OCD, bipolar disorders, and other psychotic disorders. Cognitive behavioral therapy is his forte, as he is highly proficient in treating emotional and behavior difficulties in people of all age groups, which include common issues like work-related stress, anxiety, lack of motivation, attention disorders, confidence issues, mood extremes, irritability, difficulty in sleeping, eating disorders, substance abuse, and trauma. Sir, we are very, very grateful to you, sir, for being with us this evening. Now I request you to handle the session. The online session is yours, sir. Sir, please.
Okay. Thank you very much for that lovely introduction, and thanks for organizing this. Actually, I have a connection to Annamalai University. My father did his BA and MA in Tamil, I think probably in 50s or 60s, I'm not sure. I'm so honored to be asked to talk about mental health. To start with, I mean, for about 30 minutes, 20 to 30 minutes, I'll talk about issues around mental health. And for the last 20, 30 minutes, I'll open up the floor for people to ask questions. I'm happy to answer, or if you want me to elaborate on any particular topic, I'll talk about that too if need be. So to start with, people talk about stress all the time. I'm stressed, I'm tense, all the time. So what does stress mean in medical terms? So stress is basically an evolved response by the human body to prepare it to either fight or flight from a threat. So it's say 10,000 years ago, 15,000 years ago, most of us were living in small tribes in remote areas. So there's a lot of threat. Threat could be from neighboring tribe, people from neighboring tribe, or threat could be from other animals. So when you see a threat, immediately adrenaline pumps in. You get into a stress state where the adrenaline makes your body stronger, in the sense its muscle tone gets increased, the heart rate increases, it pumps a lot more blood into the muscle so that the muscle is better prepared to either fight or run away. And also you breathe a lot so that you can take in more oxygen that blood can carry all around. So in acute stress, where there is an adrenaline rush, your body is prepared and it's fine, it's good type of stress, it helps you to come out of the situation. But in chronic stress, which is what most of us are experiencing, there's a hormone called cortisol that gets released. Cortisol is, what happens is cortisol also affects the glucose metabolism, and it also affects the brain. So it also increases the muscle tone of the blood vessels. So with chronic stress, like for example, even though we are not fighting any animals or other people, in day-to-day life, it's sometimes, walking into your superior's office might feel like walking into a, cage where the lion is. The body reacts exactly the same way as how you would react all those years ago, even though things have changed. Because of that, a lot of hormones get secreted and these hormones have an impact. So what impact does it have on a chronic level? So the first is physically, it makes your blood pressure increase. So people develop hypertension. And second, because it affects glucose metabolism, it also makes people more diabetic. Even though food habits and other lifestyle incidents cause diabetes, stress also can add to it. So these are two common physical things people experience. Then about the mental health side of things, chronic stress, what it does is people call burnout. A lot of people get burnt out of the job. Like in our parents' days, people could do job for 30, 40 years because they would go to the job at 9 o'clock or whatever time. They do the job, finish it at 4, 5 o'clock. They go home, they rest, they relax, and then they go back to work. And the weekends, nobody calls because there was no telephone call to give you more work. There was no email. There was no, no 24-hour communication technology to affect your well-being. So people could get good rest, so they could do the same job for years. But now people feel they are on 24-hour job. Whether you're at home or at, even on holidays, People can still contact you by phone, send a WhatsApp message, send an email. So there's this constant sense of being at work, which then adds on to the stress, which is what causes the stress. So if you understand it, then it will help when you plan to manage the stress, then it can help you to plan your life in such a way where you don't feel you're like on call 24 hours a day. And so people, what happens is after a few years, they can't do it anymore. Now they either want to change jobs or completely stop working in spite of the financial risk. So that's, we are seeing this more commonly now. And if you look at IT world, a lot of them after 5 years, 6 years, they don't want to see a computer ever again. So burnout is a very common problem. Then in more severe cases, what happens is chronic stress, it starts to have an impact on their mood. So people develop depression. So, I mean, nowadays people said I'm depressed for anything and everything, but actually clinical depression means there are certain set of symptoms that people need to experience. It's not just feeling a bit down or feeling a bit tired. For one to be depressed, one, they need to have low mood, and then loss of energy, where they feel tired most of the time and everything feels like an effort. Then they also lose enjoyment. Now, whatever used to make them happy, now it's not making them happy anymore. So for people who used to read the books or listen to music, watch movies or play sports, they just, it doesn't give them the same joy as before. So that's called anhedonia. If you get these symptoms, and along with it, sense of worthlessness, people feel that, they are not good enough, they are useless, these type of negative thoughts. And sometimes people start to feel hopeless that nothing's ever going to change. What's the point of living? And then they start to develop suicidal thoughts. So all these things, you don't have to have suicidal, but if you have low mood, loss of energy, loss of appetite, where you don't feel hungry, or you lose interest, and you develop worthlessness, hopelessness. These things, if somebody has it for more than 2 weeks, then we call it depression. So if it's that severe, people need to seek help for it. And sometimes people develop anxiety. No, feeling afraid is very normal. Everybody feels fear. Again, it's an evolved emotion to keep us safe from threats. But sometimes the fear becomes overwhelming. Every part of our life, even you wake up, you almost wake up with a sense of dread as if something is going to go wrong. And some people experience increased heart rate, like palpitations. Some people feel breathless. There's a tightness in chest. Some people, when they're having an anxiety attack, they think they're having a heart attack and actually go to casualty, get their ECG done, all those things, and they'll say everything is fine. But inside, they feel that, so this can be a real issue. And as I told you, so high blood pressure, diabetes, anxiety, depression, burnout, all these things can be a result of just experiencing stress on a chronic basis, on a regular basis. So what do we do about it? Okay, I'll come to that a bit later on. I'll just briefly talk about, how this working from home has contributed to it more. And then we'll talk about how best to manage it. So at least when we were, going to office or going to university, you still had some time to talk to your friends, your colleagues, because it's very therapeutic to, have people around. As Dr. Ambedkar said, it's good to be in touch with people. It's scientifically proven that your stress hormones are lower when you are with your friends. So when you go to college, you meet, and then in the evenings, you have structured the day in such a way that at least in the evenings, even if you know that you can get email and all those things, you can still relax a little bit, or you can visit family, or you go out to a cinema, or eat out, do something that helps you to relax. Unfortunately, because of the lockdown and working from home, people are not able to meet their friends and not able to do anything outside. Everyone is stuck indoors. And so our normal way of letting off our frustration is now shut off. So people are letting off their frustration towards their husbands, wives, children, parents with whom they are living, within that four walls. And now I'm seeing more and more patients, complaining of feeling more irritable, getting into more arguments. And this is, again, this information is reflected all over the world. Incidents of domestic violence, where even physical violence has increased all over the world during the time of pandemic. So that's how lockdown has specifically increased the stress levels for people at home. Then the other aspect is about the work while lockdown is happening. Now, as I mentioned earlier, you can get an email at 8 o'clock in the evening saying we need certain tasks done before, like with a deadline of 2 days. So you might have thought about relaxing at 8:30, watching a nice movie. Now that you've seen the email, now your mind starts to wonder about where are you going to find the time to finish the task. And even if you try to relax, your mind is partly preoccupied with the pending task. So these are issues that now have made stress even more prevalent in the society. So what do we do about it? So the first thing is, people need to sleep well. People ask me, why is sleep so important? Because most of our recovery, our memory consolidation, and our what's called the healing of the brain, where all the inflammation of the body gets settled or rested during the later half of the sleep. So having a minimum of 7 to 8 hours of continuous sleep is way more important than people sleeping for 10 hours with break. Like some people sleep for 4 hours, then get up, watch some video, then do some work, then go back and sleep for another 3 hours, then get up, do some work, and then sleep another 3 hours. So in total, they might have slept 10 hours, but the quality of that sleep is very poor compared with even 8 hours of regular sleep. If you haven't slept well, you will notice the next day you are more irritable and you're feeling more hungry, and you'll be consuming more carbohydrate, which then it makes you more hungry. And then people, if you see people with chronic sleep deprivation, they'll also be putting on weight. You will be seeing them more and more irritable. They'll be less productive. And you can see how it impacts your personal life and your professional life if you don't sleep well. So that's the first thing. Because all the other things that I'm going to talk about, it will have minimal impact if you haven't got good sleep. So whatever you do, please make sure you at least get 8 hours of regular sleep every day. Then the second is activity. Activity, you would have seen all these kind of WhatsApp forwards about what is the biggest killer. Is it carbohydrates? Is it stress? Is it lifestyle and all those things? And at the end of it, they'll put the image of a chair, because most of us have become sedentary. Sitting in chair probably is the biggest reason for people getting all these cardiovascular problems, because we as humans were never designed to sit in chair for this many hours in one go. So what you would need to do is at least walk in between. You don't need to go for long walks. After 20-30 minutes of sitting in the chair, you can just stand up, go and get a water to drink and come back. So as long as you're constantly moving, that is better than just sitting. So that's very basic. Make sure you move once in a while on a regular basis every hour. So that would just save you, but that won't give you any benefit. It just protects you from harm. The level of activity that is actually recommended is about 20 minutes where your heart rate goes above 120, 130, and you start to sweat. Because at that level of intensity, what happens is brain secretes endorphins. Endorphins are natural feel-good chemicals that make you feel energetic and more positive. And you'll know. So if you have done that level of exercise, you will notice on the day you're feeling more optimistic, you're feeling more energetic, and you're happier, and even people around you would notice. And on the days that you don't get the endorphin, even if you exercise, you won't get that. But so make sure if you can get, you don't need, again, like when people, the minute you talk about exercise, people's brains switch off because nobody wants to exercise, or people think, I don't have time, or I can't go to the gym, or I don't have any, fancy equipments, weights or treadmill and things like that. You don't need any such thing. Okay. You don't need any equipment. You don't need any special dress. You don't need to spend money. Imagine you have a skipping rope in your hand, and just jump up and down thinking you're actually skipping. And if you initially you might do 50 or 100 jumps, then you can build it up to 1,000. Depending on your fitness, you can do even 10,000. And what you would notice is after doing 100 or even 50, if you're starting very fresh, you might even just after 50 jumps, you would, if you check your pulse rate, it will be high, and you will show signs of starting to sweat. So just that, and people who are a bit more fit, bit more young, you can do jumping jacks and do push-ups. That will get your heart rate up, and that will lead to the secretion of endorphins. And once you get used to it, it's something that you'll enjoy. And you would see that in the West, when you go overseas, or if your children or your family member are overseas, even in peak winter when it's snowing outside, you'll see people going for a jog. And if you ask them about it, they'll tell you, well, if I don't go for a jog that day, I feel very tired and down. Whereas when I run, I come back, I feel so energetic and fresh. So please try. And even, so again, the minute you talk about exercise activity, people think, it's not for me, I'm too old, I got arthritis, or I'm this, that. All you need is, like jumping up and down for 100 skips, it won't even take you 2 minutes. Okay. If you think about it, you'll have plenty of time. So just 2 minutes a day. Start with even a minute, 1 minute of jumping up and down in between, and you can build it up. For exercise or physical activity is for the natural endorphin secretion, which makes you feel good, which helps to reduce the stress level. The whole point is about how to reduce stress to keep your mental health. So if you do that, that will help you cope with all the stress that comes along the way. Then after you do these two things, then the thing we focus on is what we eat. Because you don't need to go on any special diets or anything. Just eat what you normally eat. But all you need to do is focus on not eating any processed food that has gone through factories, that is coming in a package. They are very harmful. So you get fresh ingredients and do whatever you make, it doesn't matter. It will be healthier than any of the processed food that you're going to eat. And eat fermented food. Fermented food has shown to be, one, easily digestible, and two, it increases the gut bacteria or the diversity of the gut bacteria, because we have millions of bacteria in our small intestine, and these bacteria produce a lot of endocrine chemicals or neuroendocrine chemicals, which helps with our mental state. And these bacteria thrive when we eat fermented food. So when I say fermented food, what do we have in our Indian diet? Is buttermilk, yogurt. Those on idli are made from basically fermented rice paste. So on pickles, they are all fermented food. So include that in your daily diet, and you'll see that you are doing better. You don't need, again, as I said, don't need dietitians advice. You don't have to go through nutrition. Should I eat this? Should I not eat that? It's very simple rule. Avoid processed food, eat natural stuff, and eat fermented food. That should cover all the things that you need to think about diet. Okay. So these are very basic stuff: sleep, activity, and eating. If we go into more advanced things, about how best to maintain our mental health, then we think about how do we think about things, and how much we know about our own self and how much we know about people around us. There is emotional quotient. People talk about IQ, intelligent quotient. There is this concept called emotional quotient that that came up in the West. Now all managers in all walk of all sorts of companies, when they go for management training, they'll get trained on this EQ. Basically, it has 4 components. One is self-awareness, where we learn about ourselves, what makes us angry, what makes us happy, what motivates us, and when we are in a situation, how do we feel? And then second aspect is self-management. We learn to manage. If somebody is making us angry, how do we manage it? If somebody is making us frustrated, how do we manage it? If we hear a news that makes us feel afraid, how do we manage it? So this is the second aspect of emotional quotient. Third is the social awareness. So when you are in a room, when you are with students or with your colleagues, when they're talking about things, just see how each person is feeling, whether you can get an idea, whether that person is feeling angry, whether that person is feeling sad, whether the other person is tired. In webinar, it's very difficult to find out. See, for example, if I was doing this in a live audience, I would know how many are actually listening, how many are getting bored. Then that would give me a feedback and I could adjust it accordingly. Whereas in webinar, it's like, with no social awareness. I don't know what's going on, how people are listening to it. So I just keep on going at the same way. So that's the difference, when you're, so that's what social awareness is, being able to pick up on how the people around you are feeling. Then fourth is social management. So if suddenly you see somebody angry, how do you help them settle down? If somebody is afraid, how do you reassure them? If somebody is sad, how do you make them feel better? So these are the 4 aspects of emotional quotient. And if you skill yourself up, you will find that you are able to manage situations which could be stressful. So if some students are irritating you, or if your colleagues are not working with the same plan, you will know how to handle them. And that again would lead to less stress, lead to less harm being done to you. And you can, you can Google it, and there are good books on it. You can read, and you can improve your emotional quotient. And by improving your emotional quotient, you can help deal with stressful situations in a more positive, productive way. Then sometimes people have thought errors. We all have our thinking pattern. The common ones people talk about is, like all or nothing thinking. For somebody, either everything is good or everything is bad. There is no in between. Either somebody is great or somebody is totally useless. But in reality, everybody has some good qualities and some bad qualities. The ability to balance it is important. And there's another thought error, where people say, glass half full or half empty. So the optimist versus pessimist type thinking. And if you are somebody who's always want to look at the half empty thing, then you can train yourself to look at the half full glass. Again, that's one type of thought that can lead to unhappiness or unpleasantness. That again will add on to stress. So there are many types of thought errors people can have. So this is where the self-awareness aspect of emotional quotient comes in. As long as you understand yourself better, then it will help you deal with situations, as I said, in a more relaxed way. Then I'll talk about mindfulness. People, meditation, yoga, all those things are helpful, but a much more easy thing to do is to just do the same things that you're doing. You don't have to change any of your life habits, any of your lifestyle. Just do the same thing slowly. So for example, if you're used to drink coffee in 2 minutes, just drink it for 2 minutes and 30 seconds, or maybe 3 minutes. Just do it a bit more slowly. If you're having lunch, take your lunch a bit longer. Don't rush it. So those few seconds and few minutes where you have slowed what you're doing, your body also would start to slow down, and the stress hormones in your body would start to go down, and your blood pressure would start to go down. So all you need to do is just do the same things, but just a little bit slowly. So that's one advantage. The other thing is you'll slowly start to become more and more mindful. You won't need any mindfulness class. You'll start to notice that you're appreciating your drink a bit more. You're appreciating your food a bit more. Because normally what happens when we are drinking coffee, we are thinking about something from the past or worrying about something in the future, about the deadlines that we need to meet. And we never actually enjoy the drink or enjoy the meal because our mind is constantly preoccupied with one thing or the other. Whereas when you start to slow things down, your mind can, then you can also train your mind, focus on what you're doing. Feel the warmth of the cup of the coffee, smell the coffee, you can taste it and drink it. And that way, when you're doing it, your mind, instead of thinking, is actually enjoying what you're doing. It's focusing on the senses. And that gives a break. And that gives a break from all the stress your brain has been processing. So for mindfulness, what I would suggest is, either tonight or tomorrow, whenever you brush next, when you put the, first feel the temperature of the water in your hand and in your mouth, so your senses are activated. Then you taste the toothpaste. You feel the bristles of the brush on your gums and teeth. When you're doing that, this is what mindfulness is all about. You are focusing your brain on your senses, on the thing that you're immediately doing. And you can build it up as we go by. And you will become mindful. And the minute you become mindful, it again reduces the stress and reduces the harm. So these are very basic things that you can incorporate in your daily life, and you'll see your stress levels start to come down, and you can manage the difficulties in a better way. Now, just the last bit, I talked for about 5 minutes, and then or maybe 3 minutes, and then I'll open up the question for 20 minutes. So it's about COVID and bereavement, because a lot of us have lost some of our close friends or relatives to COVID, sometimes even in immediate family, and the bereavement is complicated. Normally, when we lose someone, we go through, your psychologist in your department will tell you, Kubler-Ross stages of grief, where sorry, I lost the contact person. We become angry, and then we become sad, or blame others, we bargain, or get depressed, and then finally we reach the stage of acceptance, where we accept what has happened and move on in life. And when we lose somebody, usually there are people around, so we don't feel lonely. Your relatives, your friends, they're all around you, and then we have a lot of rituals, which phases out the grief period. And after a month, those type of rituals that help us slowly come to terms with what has happened. But because of COVID, sometimes we are not even able to see the people we have lost. Nobody can visit, so we are going through it in a more isolated way. And the question of, because it's an avoidable cause of death, we always, go through this particular stage of bargaining, and where we think that, we could have done something better. If we have gone to a different hospital, or if we have started the treatment, it's things like that. We just go through within our mind more and more, and we struggle with it. And that has, people have lost. If you notice any of your friends or your colleagues or somebody have lost, and if they're starting to feel more down, if they're starting to isolate themselves, you can reach out to them. They may not want to talk, but you can reach out to them just to help them feel that they are not alone. And I'll finish at this point, but these are things that you can do to help people around. So I'll open the floor for questions, and if there are any, I take it. Or if you want me to talk about any other topic, I'll talk about that too.
Yes, sir, you can continue, sir.
Okay. Hello?
You can continue, sir.
Okay. So now I'll probably talk about gadget addiction and all the emotions around it and the stress people feel. Because a lot of people are at home, either glued to their computer screen, TV screen, and their phone, and a lot of people spend time on Facebook, YouTube, Instagram, WhatsApp. I'll talk about how it can impact your mental health and well-being. So let's take Facebook for example. The longer somebody spends on Facebook, the more depressed they become. And initially this was done in Germany, and then in many places they have replicated it. And they have worked out why that is the case. Because when you watch or when you look at Facebook feeds of other people, their life seems to be much better than yours. Either their families seem happier, they go on nice holidays, they go to nice restaurants, they are having a great life. Whereas our life, we are having problems with our families, there are problems with money, we are not able to go on nice holidays, we are not eating out, and it all feel very difficult. But actually, if you look at it, what I always suggest to my patients is, let's see whether your life is that bad if you go and look at your own Facebook feed. And then you put only positive images. If you look at your own Facebook as a third party, you will see that your life is actually pretty good, because even your family seems happier and you have put nice holiday photos and all the positive things that have happened in your life. And so awareness around how Facebook is not real life and it is a filtered version of real life is important. Sometimes people forget it and they start to feel down that they are the only ones having difficulty. So that's one way of how your mental health is affected if you're spending time on these things. And again, in Instagram, everybody else seems to be more glamorous and all those same issues of comparing with others and feeling down. Then when we come to YouTube, the YouTube algorithm is created in a way where it pushes more extreme emotional content on your list. So nowadays, it's a very polarized world. If you're for any religion, any caste, any language, there will be messages bombarding you saying you're under threat. If you're a Hindu, all the other, there are comments about Christians and Muslims and things like that. And if you're a Christian or a Muslim, you have comments about, all this Hindu, that. And if you're of a particular caste, the other castes are doing this. If you are, and if you're of certain, all these things. And the reason is they've worked out that when people are more enraged and angry, they seem to be more engaged. So the more we watch those videos, the more they make money. It's as simple as that. But if you look at real life around you, people of all religions, caste, language, everybody is getting along, and we are not, not one is trying to take over the other. All this, constant threat that they are pushing at us is not how the real life is. Of course, there are issues. I'm not saying there are no discrimination or all the other difficulties, but it's nowhere near how it's portrayed if you live in YouTube. And what that does is, because, as I talked earlier at the start, when our body senses a threat, it secretes these hormones that gets us stressed and all the damage it does. So when you keep watching these videos, what happens is your body starts to secrete these stress hormones on a regular basis, and then it will impact your mental health, it will impact your physical health and all those. So be aware about what message is being pushed to you and how to manage all these emotions that is triggered in you. Then the other thing is how they actually designed it to be addictive. Because when we were young, the idea of feeling bored was very normal. Regularly I'll be complaining to my parents about feeling bored. Then you walk to your friend's house, there was no phones, and you go there and the friend is not there. His mom would tell you, it's gone to another friend's house. And then you'll be kind of walking along, and boredom is part and parcel of life. But now, the second we get bored, we'll immediately go to the phone. I do that too. I'm not saying that because my brain is exactly the same as everybody else's brain. So we are all, and the minute we touch the phone, we get a dopamine hit. Either there is some new information, either you look at what I mentioned, all those things, or you you look at websites. So something, there's always something to do when you have your phone in your hand. So we don't get bored. And because of this dopamine hits, we get addicted to it and it starts to impact our life. So now people's sleep is affected because most of us are watching stuff late in the night and the screen, their wavelength is very much like the sunlight. So the the melatonin doesn't secrete at night because the brain thinks it's still day and we don't get sleep. And then, as I talked about all the other issues. So the modern phones, all the things, gadgets, they are very addictive. They can make you depressed. They can make you feel stressed all the time. So just be mindful of how you use it. And that alone will have a huge impact on your life and your mental health. I think some people might have posted questions. I can see here and there. I think one was about, I guess teachers are stressed about online class, how they can overcome the stress. Yes, because ask the same problem. Because at least when you are teaching in real class, it's easy for you to get a feedback on your students, and you can keep a class under your control. But now, it's very difficult to conduct a class over the online because we don't know whether the students are listening or not, and whether what we are teaching are they able to understand. And so the stress comes in because we feel we are not in control and we are not able to control the situation. Because especially teachers who used to be in control, who like to be in control because that's the only way you can get anything done, suddenly feel completely powerless and helpless in the situation. And that really is tough for you. So all I can suggest is, if you can find a way to let go of the control and accept it, things that hopefully things would settle down and the classes would go back and you will be able to do your things. So just accept a little bit this, because you can't change too many things. So there's no point in getting stressed about things that you can't control. And being from food tech field, can eating foods that we dislike trigger stress? No, I mean, like, eating food that we dislike shouldn't trigger stress. I mean, you can get stressed because you don't like it, but that's different. That won't really lead to any secretion of stress hormone. No. So you can eat things that you don't like, but if you eat things that are actually, like as I said, processed, your digestive system gets affected, your bacteria gets affected, and that has a huge impact. I think one question was about easy warm up for senior citizens. I think again, for them, just a gentle walk is easy warm up. It might be difficult for them to jump up and down, but you can start with gentle walk, because when you start to walk, what happens is your blood vessels, your peripheral blood vessels get more blood pumped in. That will warm up your body, and it will make your joints a bit easier. Then you can start stretching and you can do jumps. Even senior citizens can jump. So nothing is limited. Your body would know. You talk much about estrogen rather than serotonin. Okay, your body would know how much it can do, and you listen to your body. If it's painful, don't push it more than that. And I think there was one question about. Sorry, I think a few questions are going up and down. So I think one question about why people talk about estrogen and serotonin. See, all hormones have an impact on our both body and brain. So like women talk about like premenstrual stress around the time of menstruation, because the hormone sessions are changing, and it can lead to an impact. Serotonin, because serotonin is the chemical that in people with depression, what scientifically has been found out is that in between the nerve cells, the serotonin level is very low. So the treatment for depression, one of the antidepressant pills that we prescribe, it increases the serotonin level between the nerve cells, and the depression seems to lift. So that's the reason why people talk about serotonin. Okay. So I think that's about it. It's around 5:20. Maybe I'll do one more question before we finish. Think, I don't know, I lost the track of how to find the question.
Sir, how can maintain mental health during pregnancy period in COVID?
Okay, okay. I think again, because even during pregnancy, what it is the fear. Because you pregnancy for regular routine checkup, you need to go to hospitals, and there'll be fear: would I get COVID if I go to hospital, and what would happen? So I think the main thing is actually understanding why we are afraid, because the fear is because of COVID, and the only way we can get COVID is if we breathe in particles. Either through our nose, through our mouth, or through the conjunctiva. So as long as we cover that part of our body, COVID virus can't get into us. So if you're leaving the house, have the mask, if need even double mask, and wear a face shield too, because face shield will stop any droplets from reaching your face. That way you can keep yourself safe, and that should reduce your stress a little bit. After a few visits, you will know that you can go out, do these things, and still return home and feel safe. So that's what I would suggest when you're pregnant. Not just for pregnancy, for anybody. Even people who have vaccinated, you still wear mask and go out. If need be, wear a face shield. Till about 70% of the people get vaccinated. I think there was a question about vaccination. I would suggest, unless you have, multiple allergies where, anything and everything leads you to having a rash or other problem, or if you're on some special medication like methotrexate or antibodies. Other than that, everybody should have vaccine as soon as possible. I mean, it's as simple as this. It's 70 to 80% of the world population who need to be vaccinated before the COVID comes to an end, or else we are going to have COVID for another few years. Last year people said 2020 is over, 2021 would be okay. Now 2021 is over, because the longer COVID circulates in the population, more and more mutations will happen, and the next mutation might be a stronger mutation. So we all might get infected in 6 months, 9 months, whenever the new variant, more stronger variant might emerge. And the next variant might emerge from Africa, from South America, wherever. So please get vaccinated. That's the only way. 70% of the population needs to vaccinate themselves for the herd immunity to reach. So all this fear mongering from WhatsApp and all the other things, they're all, rubbish basically. So please, whichever vaccine that you get, go for it. So that will be my last message probably. So please, no fear, go and get yourself vaccinated.
One participant asked about the third wave, sir. How to procure the card?
Yeah, I mean, there may be a third wave, there may be a fourth wave. I think Japan is going through its fifth wave now. As I said, because the immunity, we know it lasts for about at least 6 months. If you have COVID or if you had the vaccination, immunity, people have known that at least for 6 to 9 months, you will have immunity. Then there might be another variant that might be coming up, and that will make it. It's like flu. Every season we get new variant of flu. So the way, unless people get vaccinated in one go, and we all are able to control the COVID, and COVID is not circulating in the population, so that it doesn't have chance to mutate and become more severe, that's the only way to stop it. As long as only part of the world is vaccinated and the other part is not vaccinated, then there will be new variant coming up, and then that person might travel to India as the first case, and then they'll start spreading it. So yes, third wave is possible, but it's only time will tell. It all depends on our behavior. It's still under control. If we all keep ourselves safe and get vaccinated, then there won't be a third wave.
Yes, sir. The other one more question, sir. The most common weakness of all human beings is the habit of leaving their minds open to negative influence of other people. Why so, doctor?
Okay. See, because we are a species that evolved socially, meaning we evolved from monkeys, and monkeys always live in groups. If we evolved from tiger, then other people won't matter. We'll all be happy on our own. The reason why other people's feeling is important is because when you are living in a group, your survival depends on your group's engagement with you. If they push you as an outcast, then it's very difficult to survive on your own because you'll be eaten by other animals or you won't get enough food. These evolutionary mechanism is still driving our behavior. That's why we always worry about what other people think. You know, you would have seen all these jokes about, you know, the naal per yaar and the naal per like now. So there's always this feeling, and it's important too, because, you know, I'm not saying that ignore all the others. Okay, because when you're working in a team, it's important that what other people think about you is, you know, will help you get better results as a team. But what you can't allow is just let their assumption control your behavior. So it's about building a sense of resilience where, I mean, this is one thing I would recommend everybody to learn from politicians. You know, we all tease politicians, we all talk badly about politicians, but that's one skill, you know, politicians, you know, people talk all sorts of rubbish, you know, but they don't care, they just keep going. You know, all these negative comments, you know, everybody is an expert. You know, you name one politician that hasn't had, you know, very harmful, negative, ridiculous comments about them constantly. But look at them, every morning they get up, they go and talk as if nothing has happened. Because, you know, so I explained why we give importance to others, because that's our evolutionary mechanism. So take that feedback into your account, but don't let it control you.
Thank you, sir. Thank you, sir.
Okay. Okay.
I think.
Okay. Thank you very much.
Messages, appreciation messages only received, sir.
Okay. 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 Thank you very much, ma'am, and thank you very much, everyone. All the best.
One minute, sir.
Okay.
I request Dr. V. Susila, Organizing Secretary, to propose the vote of thanks.
Okay. Thank you. I'll wait.
Good evening to one and all. It is our privilege and pleasure to greet and thank the dignitaries and elite gatherings who have participated in the one-day online webinar on mental well-being during COVID-19, organized by the Department of Education, Annamalai University, Annamalai Nagar, in association with MIAT Hospitals, Chennai. We do greet with due honor our illustrious members, syndicate, and Vice Chancellor, Convener Committee of our esteemed university, Professor Dr. M. Srinivasan sir and Dr. Balaji Swaminathan sir, a living force of success with great accomplishments and achievements for the development of this university. Thank you, sir, for permitting us to conduct this online webinar. We wholeheartedly thank our beloved registrar, Professor Dr. Gnanadevan sir, who is an eminent educationist, ardent researcher, and able administrator who extended great strength and support for organizing this one-day online workshop. Thank you, sir. We sincerely thank our revered Dean, Faculty of Education, Professor Dr. P.V. Shelvam sir, an eminent personality not only in the field of physical education and sports. He shows a very keen interest in the field of yoga and always extending his support to the department activities, and graciously accepted our invitation, delivered the inspiring inaugural address. Thank you, sir. We wholeheartedly thank our professor and head, Department of Education, Professor Dr. B. Ambedkar sir, an eminent educationist par excellence, who bestowed his keen interest and dedication for the development of the department, who has kindly accepted to our request and extending his support for organizing this webinar successfully. And thank you, sir, for your valuable presentation. Our profound thanks to today's chief guest, Dr. S.P. Kurunjinathan sir, Head of Psychiatry, MIAT Hospital, Chennai, who is an precious time for having successfully conducted this program, and also kind enough to our request offered his wonderful special address and lecture on mental well-being during COVID-19. So doctor has delivered a wonderful lecture, very useful and rich in content, informative, especially during this pandemic situations. Sir has highlighted about why sleep is so important. At least 7 to 8 hours regular sleep is every day is essential. and he has highly 3 minutes once a while, especially for the work from home. Then food habits, eat natural foods, avoid processed and chat foods and all. And he has highlighted 4 aspects of emotional quotient, that is self-awareness, self-management, social awareness, and social management, and thought errors and mindfulness. And he has highlighted about usage of gadgets and social media platform. And he has highlighted the disadvantage also about the addiction and all that influences and increases the stress hormone like dopamine and all. So especially during the odd hours. So thank you, sir. And he has clarified all the doubts raised by the participants also. Thank you very much for your wonderful event. Then, and also thank the organizers of this program, Dr. Pravina Madam, who has delivered the welcome address, and Mr. Jayaprakash sir, who has given technical support and enormous cooperation in the organization of this event. And I thank Mrs. Vijaya Madam for a prayer song. And I also extend our thanks to all the participants for being a part of this program, who have actively interacted and made the webinar purposeful and a grand success. Once again, I thank each and everyone here. Thank you very much. Thank you.
Thank you, Susila Madam. The feedback link is being given. You can fill in the feedback so that you can get your certificates. I request all the participants to come on to the video so that we'll have a group photo of the session. Kindly, I request all the participants and all the dignitaries to come on in the video so that we'll have a group photo. Thank you, sir, for your valuable lecture. We are very happy to have you with us in this occasion, sir. Thank you for sparing your valuable time and being with us.
Thank you very much.
I must also thank Kirtana, who coordinated between doctor and myself, sir.
Thank you, madam. Thank you, doctor. Thank you, Dean sir. Thank you, Mashuri sir. Thank you, JP sir. Thank you.
Thank you, ma'am.
The feedback form is available. Kindly fill in your feedback. The certificate you will be getting it in 1 or 2 days. The photo session is over. Thank you for your valuable presence. I'm sure you should have enjoyed it and you should have got a nice inputs regarding mental well-being. Thanks, one and all. Madam, thank you, Madam Susila Madam.
Thank you, madam. Thank you, madam. Thank you.
Bye.
Can we leave the madam? Leave the session, madam?